So this is a new way that we can do traction, and this is specifically for that person that has symptoms that improve with extension. So it's an extension bias protocol. We're going to raise this up a little bit, and since it is new, bear with me. I may make some adaptations before I get it just right. But Luke, instead of laying on your back like we normally would have somebody lay for traction, I'm going to have you lay on your stomach. And what I want is, if you were wearing a belt, I would want that belt to basically be lined up right there. So you're going to be on your stomach with your belt line right there. I'll try to hold this into position. There we go. Perfect. Good. And then I don't mind him being propped up here just a little bit, just because we want to promote a little bit of extension. If that got tiring on his neck, we would have another option. But from here, it's very much like we would do if he was on his back. It's just we're pulling that one over, pulling the top one over. So we're getting a nice belt loop there. I'm going to hook in right here. And you want to make sure that the ring ends up in the middle, just like we would if he was laying on his back. And of course this has to be tight, but I don't want it to be painful. Are you okay with that, Luke?
Yeah.
Okay, that's going to be pretty good. And then from here, I am going to go ahead and get our rope out of here. I'm going to pull on that so that it's long enough. And we loop this over, again, just like we would if he was on his back. And we're going to clip you in right there. Attach this there. Take the slack out of it. Okay, and then from there I'm going to turn the machine on. Same sequence we use for the other traction protocols. We're going to start by setting the timer, so I'm going to press treatment time. We're going to go, say, 15 minutes on that. Okay, now from there I want to set up the pull. I always want to start pretty light, so I'm going to set the minimum level to 5 and then the maximum level to 10, just so that he doesn't get a pull that is at all uncomfortable to start with. I'm going to hit start, and it's going to start to pull, and then once it gets to that minimal level, I'm going to press max level, and I'm going to start inching our way up by pressing the up arrow. And Luke, you're going to start feeling that pull on you a little bit. It may even slide you a little bit. And what I should have really done was probably place something underneath your legs first. That would be too high. But let me do that real quick. I told you I haven't done this one as much. Luke, lift your feet up just a little bit there and then let them back down, please. Good. So that will be more comfortable. Should have done that before. I'm going to continue to turn this up. And Luke, you're going to feel yourself slide just a little bit. And you notice that I did not put the belt around Luke's torso up here, just because with the weight of his arms and everything, he's probably not going to let himself slide. If I was using heavier resistance, then sure, I might add the torso strap here as well. But for these lighter weight loads, we don't need to. You feeling that pull a little bit, Luke?
Yeah.
Is it uncomfortable at all?
Nope.
So it gets to 39. It will not allow me to go any further until I acknowledge that we are doing a lumbar spine. And that's just a safety mechanism, because if we were doing the cervical spine, you would not want to exceed 39 pounds. So I'm going to press that, and then it's going to let me turn it up higher. We can do up to 75% of body weight, but I think this is probably pretty good for Luke's first time. And now from there, If I just left this alone, then it would eventually time itself out, and that, you know, the treatment time would be cut short. So I'm going to press start here, and when I do that, that trips the timer, and now we're going to start counting down from 30 over here. And the other thing that I did wrong, I should have given Luke this button before we even started to turn it off so that he could have turned it off at any time. But, and one thing that I think we're going to find with this device, the button is down there, so you would actually have to reach down and press it. There you go. But again, I want you to turn that off anytime you want. Now, if I really wanted to combine some treatment time here with Luke, while that thing was pulling on him, you know, I might just kind of stretch through his mid back here a little bit. And again, this would be a higher level patient. You doing okay with that, Luke?
Yep.
So we can do some manual therapy. You heard a little click in there. Did you hear that one? By the way, those clicks are cavitations. The way that we want to explain those to patients is sometimes they make noise, sometimes they don't. All a cavitation is a change in pressure. So if you had a suction cup on your refrigerator and you pulled it off, what would happen in that case, there would be moisture that would be that would be in that suction cup area, and that change from a really low pressure to a sudden high pressure would cause a would cause the liquid to go from a liquid state to a gaseous state, and it would make a popping noise. Well, when our joints are kind of stuck together and we move them, especially if we move them kind of rapidly or beyond the position they've moved in a while, that same kind of cavitation can happen. And so that's all that popping is a cavitation effect. Feel okay, Luke?
Yep.
Where do you feel most of that stretch?
Lower back.
Yeah. And it is a good stretch. So be careful with it, but just another way that we can do traction. Now, if I want to cut his treatment short here, let's say it didn't go through the full cycle, to do that, I'm going to come over here and press, and you can't even read it. They wrote it so small, but I'm going to press that button right there, and it's right below the 6, and that shuts it off. So now you can see the force is decreasing in that rope. And that's the proper way to shut it off. And then as that force exits the system, we can hit power, and then from there I could create more slack by pulling the lever, pulling the rope. And remember, don't let a person jump right up after traction. Have them rest a while, especially if it's their first or second time. Remind them that they may get a rebound effect, and with that rebound effect, get some achiness afterwards. And if it happens, let us know about it. But ultimately, we do this primarily to reduce radicular symptoms. In this case, we have an extension bias.